Guys, welcome to our gross anatomy lecture. Today we're going to talk about the proximal and the distal radioulnar joint. Right, these are very important joints because they are going to be responsible for pronation and supination of the forearm. Right, so let's start with the proximal radioulnar joint. So the proximal radioulnar joint is between the following. You're going to have the head of the radius, the radial notch, the annular ligament. So this is a synovial pivot joint. Very important. It's a synovial pivot joint. So you're actually going to have the capsule of the distal of the proximal radioulnar joint being continuous with the elbow joint together with the synovial membrane. Right. So what is important is to take note of this ligament, which is the annular ligament. Right. So it attaches from the anterior and posterior margins of the radial notch, and then it covers the head of the radius, right, like a collar, like sort of like a collar. And take note, it does not attach to the head of the radius. It doesn't attach. It just winds around it. It doesn't attach. Good. Right. So what are the movements of this joint? So this joint is the one that is responsible for pronation and supination. So anteriorly, you're going to have the muscles like the supinator muscle, and you're actually going to have the radial nerve as it terminates into superficial and deep branch. Posteriorly, you're also going to have the deep branch, the deep head of the pronator muscle, right, and the common flexor tendon, which is the lateral the tendons coming from the lateral epicondyle. Right. Let's take a look at the distal radioulnar joint. This is the distal radioulnar joint. It's actually between the rounded head of the ulna, the ulnar notch of the radius, and the articular disc. Right. NB. The articular disc is a fibrocartilage that is triangular in shape that actually attach from the apex. Its apex attaches the silent process of the ulna. Its base attaches to the lower portion of the radioulnar of the ulnar notch, right? And it separates or shut off the distal radioulnar joint from the wrist joint, right? So this is also a synovial pivot joint, which is also going to be surrounded by a synovial membrane, right? And it's going to have some weak anterior and posterior ligaments, right? So what is important about these two joints is this. Supination takes place, supination and pronation takes place in the proximal radioulnar joint. The distal radioulnar joint is always fixed, and both of them, they are synovial pivot joint, right? So thank you so much, guys. See you next time. Take care.